Hey everybody, welcome to another episode of Innovation Journal Club. My name is Paul Singh, an anterior segment glaucoma surgeon out in southeastern Wisconsin. And this is an episode, and this is a series that actually focuses on podium presentations, papers that are published, but also talking about publications from the US and OUS experiences. More importantly, taking those data sets and really translating them to what we do in clinical practice today. So today we're going to talk about some of the new kind of innovations in cornea, anterior segment, and of course I am truly honored and privileged who won an award, of course, which is congratulations on your ASCRS award as well. Marguerite McDonald at OCLI out in New York. Thank you for being here.
My pleasure, Paul.
Yeah, I am so awestruck. Every time I meet with you, I'm like, oh my God, that's Margaret McDonald. You've done so many amazing things, and of course, cataract refractive, of course, with excimer laser. But today we're going to focus a lot on actually something different, which is reversal of mydriasis, a new kind of compound, phentolamine. Talk to me about your experiences with this or your thoughts on this study we'll talk about, which is kind of reversal of mydriasis with a new compound. Talk about phentolamine a little bit.
Sure. Phentolamine is an alpha adrenergic agonist, and it has been studied for reversal of mydriasis, for presbyopia, and dim light disturbances. And it's unique in that it doesn't stimulate the sphincter muscle, it blocks the dilator muscle, which makes it very safe. It doesn't pull on the peripheral retina. So people with retinal pathology, high myopia, etc., can use this drop without worry about a retinal detachment.
And that's exciting because I think that was some of the limitations of sometimes the constricting medications that we used was a fear of some of the adverse events as well. But also, I think some of the headaches and issues that we talk about too with kind of constricting iris sphincter muscles as well. And that's something we'll talk about with the data set out there.
Yes.
But let's talk a little bit about kind of the study that was done to look at this in clinical practice in terms of reversing mydriasis. There's a study that came out here, and I'd love to talk about this phase 2 trial of phentolamine in patients with night vision disturbances, looking at patients who were dilated and bringing those pupils down as well. Talk to us about this study if you can.
So the night vision disturbances, I presented that at this year's ASCRS. There are a lot of people out there, a lot of patients with trouble at night. And it's not just people who had RK years ago or early LASIK. It's people with early anterior cortical cataracts, a host of people. If you ask, people will say, yes, I can still drive at night, but I'm anxious. I can do it if I have to. I'd prefer not to, etc. So they took a drop, so it was the classic study design, vehicle versus active ingredient, and one drop a day. And the people who received the active ingredient, phentolamine, had an increase in their vision at night, both 3 letters, ETDRS, 3 lines, and 2 lines. So there was a statistically significant difference between treatment group and vehicle as far as their vision, their pupillary diameter, and contrast sensitivity. And not only did the effect not wear off, it got greater at 2 weeks. They actually got a little more effect at 2 weeks than they did the first time they tried it.
And so again, this is for people who had night vision disturbances. Okay.
Yes.
So this is not patients who were just dilated in the office. These were patients who were having complaints at home as well.
Yes, this is dim light disturbances, people driving basically at night.
Help me out because you're so amazing at this. What does it mean to have better contrast? I mean, I know dim lighting and driving, but just in general, I don't know if everyone understands the impact of improving contrast from daily function besides driving, and how much is clinically relevant, I guess, improvement.
So when I explain it to a patient, I'll say, when we improve your contrast sensitivity, when you're driving at night, in the rain, in the dark, you'll better be able to see that little girl in the gray raincoat as she steps off the curb. That's powerful illustration. It'll make it easier to spot other vehicles, dogs, cats, humans. The safety angle here can't be overplayed.
That's important. And we also have phase 3, I think, findings too with phentolamine as well. I'm not sure if you want to talk about that because I want to get into the clinical use of this product eventually, this molecule eventually when it gets out as well. But talk about this real quick, and then we can talk about kind of where we think this is headed for us in clinical practice as well.
Sure. There were 145 participants in this particular study. They took it once a day over 2 weeks. And the primary endpoint was 3 lines or more of improvement in low contrast distance visual acuity. And they achieved this easily, 13% versus 3% for the placebo, which was statistically significant. And the secondary endpoints was 15 or greater letters of improvement in vision during low contrast circumstances, 21% versus 3%, highly statistically significant. And they even looked at patients with 10 or more letters of improvement at day 8 and day 15. And there was actually an improvement over time. So it was 41% at day 8 and 44% at day 15. There are no serious adverse events. All the adverse events were predominantly mild and did not lead to discontinuation of the drop.
Well, that's important. I think tolerability, and someone who's in the glaucoma world, I think that's a huge issue because no one's going to take a medication if they have headaches, they have hyperemia, they have issues with it as well. So now we have a couple. We have phase 2, we have this phase 3 data talking about the kind of contrast and improvement in pupil size and bringing it down. What does this mean to you, clinical practice? And I know it's not approved yet. Nixol is not quite there yet, phentolamine is not quite there. What do you think this is going to be utilized in terms of what capacity in clinical practice?
I think there will be an enormous number of people who have dim light disturbances. All the people I mentioned before, LASIK from the past, early LASIK when we didn't have the centered, beautiful ablations we have now, old RK patients, people with corneal scars from herpes or trauma, but the early cataract patient. Mm-hmm. So they don't quite meet the criterion for cataract surgery, but they have dim light disturbances. That's a huge group of patients, and they will benefit tremendously.
Do you think for things like dysphotopsias post, let's say, multifocal lenses, this could help too as well?
I expect it would.
Yeah.
We'll have to study it, though.
We'll have to study it, of course. Yeah, and then again, of course, it's not approved yet, and we're talking about different indications, but talk about the use of phentolamine too and the potential use for presbyopia correction too. Your thoughts on that?
The phase 3 results are extremely impressive, and they were presented here. Phentolamine for the treatment of presbyopia at ASCRS for the first time. And they met all their endpoints. It's highly effective.
Yeah, I think the longevity of effect, which is really, a big issue we face with a lot of the presbyopia medications that are coming out, is how long is something going to last. And I think phentolamine, if you real quick, seems like it has a little bit longer lasting effect than some of the cholinergics do.
It does. So it lasts 18 hours. It's given at night because it does make the eyes red. There's some conj erythema. But that wears off by the time the patient wakes up. So they have the effect, and the redness is gone. So it's being studied both as a standalone evening drop and also with a morning booster drop of low-dose pilocarpine, 0.4%.
That's interesting because you can titrate depending on the patient's severity level, depending on kind of what their activities are. You don't have to use say a cholinergic in the morning if you don't want to.
And they both met their endpoints.
Yeah, independently.
But it's a nice tunable option.
I love that. Tunable presbyopia correction. I like that. That we never had before as well. Well, this is amazing, Marguerite. I appreciate you giving your insights on this new molecule. I think it's exciting to see that there's multiple uses for us as clinicians, whether it's on the reversal of mydriasis, whether it's for those patients who have night disturbances, or even potentially for presbyopia correction. Really exciting stuff. Thank you for being here.
My pleasure.
Thank you so much. And thank you, everybody, for taking the time to watch this episode of Innovations Journal Club. I know I learned a lot from the master here, Dr. McDonald, but hopefully we'll have another episode coming your way in the near future. Thanks again for hanging out.